This morning via Skype to discuss self-imposed prevention measures that can mitigate the COVID-19 epidemic. And to further discuss the study is Dr. Kelly Victory. She's a trauma and emergency physician with a specialty in disaster preparedness and response and public health. Doctor, good morning. Thank you for joining us.
Good early morning, Jason. This is an interesting study and replicates what we've seen in other studies, frankly, on this topic, and some meta-analyses of studies that are looking at what we call non-pharmaceutical interventions to mitigate the spread of a virus. And when I say non-pharmaceutical, what I mean are these social things like hand washing, mask wearing, disinfecting surfaces, social distancing, and then respiratory etiquette, the idea of sneezing into the crook of your elbow or into a tissue. And what's interesting that we find with these is that although they all make sense, common sense, or seem in theory that they would work very well to slow the spread of the virus, we're finding that it's not probably quite as effective as people had believed. Now, it has to be said that these studies are all looking at influenza, not COVID-19, because COVID-19 is just too new. But it makes sense to look at influenza because we know that that is also a respiratory virus that spreads in very much the same way as COVID-19. And unfortunately, when we look at those studies in the past on influenza, we find that there is limited data that indicates that we should be doing all of those things, constantly washing surfaces, wearing masks, and social distancing. The other thing we can do, in addition to looking at the study, is to look at actually what we are seeing real time. And we know, for example, with our experience on the cruise ship that was for many weeks halted off the coast of California, that although there were people, for example, who tested positive for COVID-19, those people stayed in a stateroom with a spouse or a partner for days on end, yet the spouse or partner did not, in fact, contract COVID-19. So those people were not socially distanced, yet the virus didn't spread. So there's still quite a bit we don't know about how to control this. But I would say that social distancing, mask wearing, hand washing, and all of those things are not the panacea, perhaps, that we initially were led to believe that they would be.
Okay, does the study suggest that we should be doing things differently?
Well, that's a very good question. I think the bigger question is, why are we frantic to stop the spread of a virus that has a relatively low lethality, a relatively low morbidity and mortality? We have to remember that this is a virus for which 85% of people who contract it don't have any symptoms or have extraordinarily mild symptoms. So it's something on par. I don't want to say it's the same as the flu, but I think in the end we will find that the overall mortality will be about on par with a bad flu season. So in general, we are trying to stop the spread of something that for the vast majority of people will have very low impact. I think we are better off, and have been from the start, simply identifying and protecting those people who fall into the high risk category. And the good news is about COVID-19 is we know who those people are. They are people largely over the age of 70 who have significant underlying health conditions like diabetes, hypertension, obesity, underlying lung diseases, and we can rally around and protect that small group. In the United States, for example, I believe it's only about 6.5% of the population is over the age of 65. And the vast majority of those people, because of their age, aren't in the working force anymore anyway. So we can isolate or protect those at-risk groups without having the draconian shutdown and lockdown of businesses that is having a profound impact on all of society. The idea of locking down schools or keeping schools or activities for children shut down, but we know that those are not the risk categories. Those are not the people we need to be protecting.
Okay, yeah, you mentioned the most vulnerable, the people we do need to protect. You just touched on the other end of the spectrum. Those under 18 years of age seem to be the least vulnerable. Is there any suggestion as far as keeping schools shut down and not getting kids back into the classroom and socializing and back to life as they knew it?
I have said before on this program and elsewhere, I think it's absolutely a mistake to keep schools shut. we know that children are at essentially zero risk of contracting COVID or becoming ill from it. In the entire state of California to date, we have not had one death, not one in the entire state of California, of someone under the age of 18 from COVID. On the other hand, the lockdown of the schools, the shutdown of children's activities has translated into significant social issues. For example, if you take that, school is the #1 place where child abuse and neglect is picked up. School is the #1 place where children's visual or hearing issues are picked up. It's by teachers, not by parents. So when we keep kids out of school, we are not only delaying their academic endeavors and keeping them, having them fall farther and farther behind compared to other countries, but we are really having profound impact on their mental health, their physical health, their social health, in addition to the fact that parents, therefore, if kids aren't at school, at least one parent in general is going to have to stay out of the workforce and stay home. So there's a big trickle down. So I would implore people anytime in public health, we have got to find that fine balance of being able to protect the vulnerable, protect people as far as we can, but do that within the balance of how much can the rest of society tolerate physically, emotionally, economically, and make sure that we are not overreacting and making the cure worse than the disease.
Okay, so in summary here, this new study suggests that we should continue to do what we're doing, but any changes that we should make?
Well, I believe that we really need to reopen the economy and spend our time and resources protecting, rallying around that small, easily identifiable at-risk group. I think that continuing to try to socially distance, I don't think is a good measure. We haven't seen that it's worked. If you look at other countries right now, for example, there are 22 countries that have been up with their schools fully running without social distancing, without mask wearing, without all these mandates. And those countries have not seen upticks in cases. They have not seen spread of the virus amongst children. And more importantly, they have not seen transmission of the virus from children to teachers or from children to their parents or elderly grandparents, for example, at home. And those countries have been up and running their schools not for a week or two, but for 5 and 6 weeks without seeing those negative impacts. So I think we are obligated to look at the evidence from around the globe, what's working elsewhere, and start to really take some comfort that we can move down that same road here in the United States.
And where does that leave us as far as mask wearing, Doctor?
I am not a believer that the average person in the public should be wearing masks. The studies, there's a large meta-analysis on the CDC's own website that looks at 10 different studies on mask wearing, and at best, someone might say it's inconclusive. I believe that at best it shows that they don't have a significant impact in stopping the spread of respiratory viruses like influenza. They should be worn by those people who are at significant risk themselves if those people need to go out in public. They should be worn by people who we know are infected with COVID or tuberculosis or influenza or any other respiratory illness. And they should be worn by the healthcare professionals who come in close contact with those people.
All right, Dr. Kelly Victory. Dr. Victory, thank you so much for your time and perspective. We sure appreciate it this morning.